We are the Jable Clot Retrieval Group, and this is our presentation for Reflection 6.
Deep vein thrombosis, or DVT, occurs when a blood clot forms in one of the deep veins of the leg, most often the popliteal, femoral, or iliac veins. This blockage disrupts normal blood flow, leading to pain and swelling in the affected limb. If the clot breaks free, it can travel to the lungs and cause a pulmonary embolism, a life-threatening complication. Even with modern thrombectomy devices, challenges remain, such as incomplete clot removal and limited first-pass success, emphasizing the need for safer, more efficient solutions to restore vascular flow. Our refined need focuses on addressing complications from soft red clots and high clot burden in thrombectomy procedures to restore proper vascularization while minimizing blood loss and air embolism. This triangle shows how our design meets that need. At the base is efficient clot retrieval, above that closed loop operation for safe reinfusion, and at the top our goal to restore flow safely and efficiently. Together these layers turn our clinical need into a clear engineering solution.
In normal venous return, blood from the lower limbs moves back to the heart through a low-pressure system that depends on valves and muscle contractions. The calf muscle pump is especially important, with each contraction pushing around 60 to 80% of the venous blood upward. That way, when a blockage forms, that flow is interrupted. Deep vein thrombosis is a result of that, when blood begins to pool below the clot, leading to swelling, redness, heaviness, and pain in the affected area. For the mechanism of clot formation, Virchow's triad explains the conditions or the environment that allows clots to form. They are endothelial injury, stasis of blood flow, and hypercoagulability. Once these factors are present, the actual process begins. Platelets adhere to the injured endothelium, for example, and activate the coagulation cascade, which converts fibrinogen into fibrin. This forms a fibrin mesh that traps red blood cells, creating the soft red thrombus typical of deep vein thrombosis. The DVT condition evolves through three main phases. In the acute stage, the clot is fresh and non-adherent, which makes it easier to remove, but also highly prone to embolization. During the subacute phase, fibroblast starts infiltrating the clot, organizing it and making it more cohesive. This is the transition point where removal becomes harder. Then, by the chronic phase, the clot is fully fibrotic and integrated into the vessel wall, causing long-term complications like PTS, post-thrombotic syndrome, and CVI, chronic venous insufficiency.
Now, to summarize the main categories of current clot retrieval and thrombectomy approaches, focusing on how each one addresses and falls short of the key needs for DVT treatment. The first category is pharmacologic, such as catheter-directed thrombolysis using TPA or heparin. These dissolve soft clots and are minimally invasive, but they carry a high bleeding risk, up to 12%, and often fail to fully clear large thrombi. The second category is mechanical coring, represented by systems like Inari Clot Retriever. These are very efficient at removing bulk and organized clot in one session, but they can cause vessel trauma and don't allow for reinfusion of aspirated blood, which leads to blood loss. The third is aspiration-based systems like Penumbra, Lightning, and Indigo. They're fast and efficient, but they typically result in 200 to 300 milliliters of blood loss per case and carry a significant air embolism risk due to open system designs. So overall, the takeaway here is that while each of these methods has strengths, none of them truly balance safety, efficiency, and cost. That's exactly the gap our Jable clot retrieval system is designed to fill, by creating a closed-loop system that prevents air entry and preserves blood volume throughout the procedure.
Shows 4 key gaps. Current thrombectomy devices are inefficient, often requiring an average of 4 passes for full clot removal. This wastes time and increases risk. Second, there are major safety issues. Open systems risk air embolism and a lot of blood waste. This inefficiency also drives high costs, with disposables alone reaching up to $15,000. Our design opportunity is clear. We must deliver a system that is clinically effective, procedurally safe, and cost efficient by ensuring complete clot removal while virtually eliminating blood loss and air embolism risk. Is strong. Aspiration thrombectomy is booming, expected to almost double to nearly $1 billion in the US over the next decade. Clinically, there's a clear shift. Early mechanical removal is now preferred because it reduces both hospital time and bleeding risk. Also, only 8 to 10% of eligible patients are being treated mechanically, meaning we have a huge untapped market. Our value proposition is to capture this market by focusing on solutions like closed-loop reinfusion and improving single-pass efficiency, which directly meet the demand for safer, more efficient procedures. The landscape is dominated by Inari Medical and Penumbra with their intelligent aspiration systems. The entire segment is validated by massive investment, highlighted by Stryker's nearly $5 billion acquisition of Inari. The most important trend we see is that emerging competitors are all focusing on the next generation of features, real-time blood reinfusion and continuous vacuum. This confirms our strategy to develop a system that integrates these features best, setting a new superior standard for safety and efficiency in DVT thrombectomy.
The table highlights the key design constraints that will guide our prototype development. On the left are the must-haves, features essential for safety and performance. Our system must operate as a closed canister sealed to the patient, limit blood loss to under 500 milliliters, and adapt at least 3 existing sheaths between 7 and 13 French ID. Must also minimize air embolism, allowing no visible bubbles and no more than 1 bubble over 200 micrometers per 100 milliliters of aspirated blood. On the right side are nice-to-haves, like being lightweight, cost-efficient, and including simple user interface.